Hi friends, I am Dr. Pratap Sanato. I have done MD in forensic medicine. In today's video, we'll continue with asphyxiant gases. In that, we'll discuss about poisoning from hydrocyanic acid. Come to source of hydrocyanic acid. Hydrocyanic acid is also known as prussic acid. Is a solution of hydrogen cyanide in water either in 2% or 4% solution. When it is 4%, it is also called as serious acid. So, hydrogen cyanide, when it's combined with H2O, forms the hydrocyanic acid. It is also found in nature in many fruits and leaves like almonds, apricot, apple, cherry, peach, plum, pear, bamboo, etc. In them, it exists in the form of glycoside called as amygdalin, which is harmless but usually coexists with enzyme emulsin, which hydrolyzes the amygdalin to hydrocyanic acid. Amygdalin is converted to cyanide in the small intestine by bacteria in presence of enzyme emulsin. So, in humans, when amygdalin is consumed, in bacteria it is converted into cyanide. It is also obtained from cassava, which is rich in source of cyanide. All parts of cassava plant is cyanide. So, this is the image of cassava plant from where which cyanide can be obtained. Hyaluronic acid is usually obtained from distilling of cyanide by an acid. The pure acid is colorless. The cyanide pure is colorless, transparent, volatile liquid with an odor like bitter almonds and is rapidly decomposed by exposure to light. About 24-40% persons cannot smell the gas of the cyanide. That is, almond smell cannot be smelled by in 20-40% cases. In hydrogen cyanide is also a normal constituent of body, which consists about 50 to 30 micrograms of body consists hydrogen cyanide. Cyanide ion has a free radical or white powders are in combination with sodium or potassium forming sodium potassium cyanide. Commonly used in many trades in metallurgy, photography, electroplating, fumigation of ships and aircraft, agriculture for spraying to destroying blight. Potassium ferrocyanide and ferric cyanide are not poisonous. So, hydrocyanic acid, there is HCN, which is hydrocyanic with when combined with water form hydrocyanic acid. Then there is cyanide free radicals, which is also poisonous, which can be obtained from plants like almonds, apples. They consist about amygdalin. From amygdalin, in presence of enzyme emulsion, can be converted into cyanide. So, the source of cyanide includes either from fruits or other with the has a cyanide ion, free radical or hydrocyanic acid can be used for poisoning. Come to mechanism of action. Cyanide inhibits the action of cytochrome oxidase, carbonic anhydrase enzyme. So, in cells, the cyanide penetrates and prevents cytochrome binds with the cytochrome oxidase enzyme and prevents the cellular respiration. It blocks the final step of oxidative phosphorylation and prevents the formation of ATP and its use as an energy source. So, the ATP formation is decreased because of blockage of cytochrome oxidase enzyme, leading to decrease in energy requirement for cells. Cyanide acts by reducing the oxygen carrying capacity of the blood and in combining with ferric ion atom of intercellular cytochrome oxidase, preventing the uptake of oxygen for cellular respiration, creating histotoxic or cytotoxic anoxia. So, mainly it causes cytotoxic or cytotoxic oxygen, although the blood may contain normal oxygen content. So, usually the blood has HB, which is free radical is present, and in the cell cytochrome is also has free radical ion content Fe2, which the cytochrome cyanide binds with cytochrome oxidase, preventing the uptake of oxygen. So, the oxygen is not bound by cytochrome because cytochrome is bound with the cyanide, leading to, even though oxygen is present in the blood in sufficient quantity, it cannot bind the cytochrome oxidase enzyme, leading to deficiency of oxygen in the cells itself. Cyanide gas is absorbed rapidly from the respiratory system and the acid and cyanide salts from the stomach. The acid is also absorbed through the skin. Absorption is easy when cyanide is taken on a full stomach or with much wine. Alkaline cyanides, when ingested, are converted by hydrochloric acid in gastric juice into chlorides, and hydrocyanic acid is liberated. So, hydrogen cyanide or any form of alkaline cyanide, when it enters the stomach, it is converted into hydrocyanic acid by when it enters the stomach by presence of the hydrochloric acid, hydrocyanic acid is liberated. When even in ichloroid person who doesn't have hydrochloric acid, even the water in the stomach can liberate the hydrocyanic acid and cause the poisoning. excretion, the greater part is converted by enzyme rhodonase present in liver and kidney into thiocyanate. A small amount is also excreted unchanged in the breath. It is mainly excreted in the urine. Come to signs and symptoms. This is most rapid of all poisons. The action is very rapid and the signs and symptoms appears based on the how much the person has consumed an effect of cyanide. When inhaled as a gas, its action is instantaneous. With small doses, the person first experiences headache, confusion, giddiness, nausea, and some loss of muscular power. With massive doses, it may produce sudden loss of consciousness and prompt death from respiratory arrest. If large dose is taken, symptoms usually occur at once or delayed, during which the victim may perform some voluntary acts like cooking, throwing away bottles, or walking also the distance. So, the cyanide may act instantaneous, or the person may be active for few minutes doing some activity. In CNS, it causes headache, vertigo, faintness, perspiration, anxiety, excitement, confusion, drowsiness, prostrations, office-ness, trismus, cramps, hypothermia, twitchings, convulsions, spasms, stupor, coma, which ultimately lead to death. In GIT, it causes bitter taste, acid reflux, burning taste, constriction or numbness of throat, salivation, nausea, and rarely vomiting. Respiratory system, it causes odor of bitter almonds is present. Initially, there is tachypnea and dyspnea, that is, there is increase in the respiratory due to stimulation of respiratory centers, but later on there is slowing of respiratory rate with severe respiratory depression and cyanosis. In CVS, initially there is hypertension with reflex bradycardia, then sinus arrhythmia. Later there is tachycardia, hypotension, and cardiovascular collapse. The heart continues to beat after for several minutes even with stoppage of respiration. So, it mildly affects CVS and it usually affects the respiratory symptom. In skin, there is perspiration and also it can cause vesication leading to bullae formation. In eyes, causes glassy and prominent, pupils will be dilated or unreactive. There is acidosis of because in the system, and that occurs mainly because of respiratory failure. In poisoning by cyanide, symptoms only if there is cyanide ions are present or cyanide powder is consumed. The symptoms may not occur for 10 to 20 minutes because it may delay the decomposition by salt by gastric juice and liberation or absorption of hydrocyanic acid. So, based on how much are consumed and conversion of cyanide into hydrocyanic acid, the time interval may differ. So, usually cyanide may be consumed as sodium cyanide or potassium cyanide is taken, and conversion of this salt in gastric juice into hydrocyanic acid takes time. Potassium sodium cyanide have a corrosive effect on the mouth, throat and stomach and cause epigastric pain, vomiting and alkaline burns of the mucosa. So, though the salts can be limited, they also have local effect where they can cause corrosive effect on the mouth, throat and stomach. Other symptoms are similar to hydrocyanic acid. Once the potassium cyanide, for example, enters the stomach, it regulates the hydrogen cyanide gas, which causes the similar symptoms. Survivors of series of acute poisoning may develop delayed neurological sequelae, especially in the form of Parkinsonian syndromes. Types of syndrome is develops. Fatal dose: 50 to 60 mg of pure acid, 200 to 300 mg of sodium or potassium cyanide are fatal. Fatal period 2 to 10 minutes, sometimes even immediate action is present. Potassium sodium cyanide can take up to half an hour based on how much hydrocyanic acid is liberated. The patient may survive for several hours due to delayed absorption. Inhalation of air containing 1 part in 2000 of cyanide is fatal almost immediately. So, if the person is enclosed in an environment with cyanide gas is present, if the part is 1 part in 2000 of cyanide is present, then it is immediately the person dies. If 1 part in 1000 is present within few minutes and 1 part in 5000 within few hours. Come to treatment. The principle of treatment is mainly to remove the cyanide cytochrome bondage. So, as I mentioned, the cyanide binds to cytochrome oxidase enzyme, and to reverse it, it has to be reversed. This is achieved by converting hemoglobin to methemoglobin by giving nitrites. So, usually hemoglobin has Fe2 plus ions, and this has to be converted into HbFe3, that is the sulfur methemoglobin. This is done by giving nitrites. So nitrites mainly includes by amyl nitrate or sodium nitrate. So in presence of nitrites, the hemoglobin, normal hemoglobin is converted into methemoglobin. So methemoglobin can be attracts the cyanide. So cyanide gets attracted towards the methemoglobin. So methemoglobin has higher binding affinity for cyanide than the cytochrome oxidase complex and removes the cyanide from the cytochrome oxidase. So cyanide cytochrome oxidase combination, the cyanide gets liberated and attracted to methemoglobin and it converted into cyan methemoglobin. So cyanide combines with methemoglobin and forms non-toxic cyan methemoglobin. So cyan methemoglobin is present. So cyan methemoglobin, which is presence of rhodinase enzyme. So in presence of rhodinase enzyme, which is present mainly in the liver and kidneys, in presence of sodium thiosulfate, the sulfate group is present. Presence of sulfate is converted into thiosulfate. So this thiosulfate is excreted in the urine. So thiosulfate converts cyanide to thiocyanate, which is excreted in the urine. So to summarize, so cyanide is usually present in the blood, which is excreted, it enters the cells to form cyan cytochrome bind, and there is oxyhemoglobin and hemoglobin free radicals. Oxyhemoglobin is not utilized by the cyanide because of oxygen cannot bind with the cytochrome, so it is already bound with the cyanide ions. So to make it to get removed from that, the amyl nitrate and sodium nitrate is given. So amyl nitrate and sodium converts hemoglobin to methemoglobin. So the HbFe3 plus. So HbFe3 plus attracts cyanide ions from the cells and liberates the cytochrome oxidase enzyme to bind with the oxygen required for cellular respiration. So once it is freed, the cyanide with that is methemoglobin leads to formation of cyan methemoglobin. Cyan methemoglobin in presence of sodium thiosulfate, which provides a sulfate enzyme, sulfate ion in presence of rhodinase enzyme form the thiocyanate. So thiocyanate can be easily excreted in the urine. Cyanide is directly converted to thiocyanate by complex of cyanides with thiocyanate under the influence of enzyme rhodinase. Cyanide is also converted to cyanocobalamin by complexing with hydrocobalamin. So if the nitrites is not available, even vitamin B12 is also useful. When vitamin B12 is also given, it also forms complex hydroxycobalamin, which can be excreted. The treatment is done by cyanide kit. So peculiar kit is available for treatment purposes. It contains 12 ampules of pearls, 12 pearls of 12 amyl nitrate, 10 ml vials of 3% sodium nitrate, and 250 ml vials of sodium thiosulfate. The procedure includes, so process is complex process to remove mainly the cyanide. So 0.2 ml ampules of amyl nitrate is broken into handkerchief and held over the patient's nose. So it is placed in the patient's nose. Immediately, the treatment should be started immediately, since sometimes the action shall be taken immediately. So amyl nitrate is broken and placed in the to convert any presence of hemoglobin to methemoglobin. Then 0.3 grams of sodium nitrate in 10 ml of sterile water is given IV, and it is continued. In same injection, the 25 grams of sodium thiosulfate in 50% is started. So this makes the conversion of cyanamethhemoglobin into thiocyanate. Both sodium nitrate and sodium thiosulfate can be repeated as required. Other antidotes include hydroxycobalamin. As I mentioned, it also helps in conversion to cyanhydroxycobalamin. It binds with cyanide, forming cyanocobalamin, with which the sodium thiosulfate produces thiocyanate. Dicobal EDTA acts as a chelating cyanide to form a harmless product that is excreted in urine. So again, EDTA is also can be used to remove the cyanide ions. Then 4-methyl aminophenol 3 mg per kg IV produces a level of 50% methemoglobin within 1 minute. This also can be helpful to conversion of hemoglobin to methemoglobin. Gastric lavage is performed afterwards who have ingested the cyanide using activated charcoal, sodium carbonate, ferrous sulfate and citric acid to remove the cyanide if it is which is not absorbed. Methylene blue is not effective in these cases. Ventilation with 100% oxygen is also useful. Methemoglobin of more than 50% in a easy contagion for exchange transfusion or antiplatelet of blood. So if methemoglobin is still present in the blood, it indicates that the cyanide is not excreted and administration blood has to be transferred. If death is delayed, a mixture of ferrous and ferric sulfate with potassium carbonate may be given as chemical antidote to form a Prussian blue enzyme. Patient should be kept under observation for 24 hours to 48 hours as cyanide toxicity may reoccur. In poisoning by inhalation, the patient should be removed from the fresh air and artificial respiration and oxygen should be started. Coming to postmortem appearance, care should be taken to reduce the exposure of individuals in mortuary to a minimum, since cyanide can be absorbed through a gas. So if the person is doing dissection may also get exposed to cyanide, so proper care should be taken. Hydrogen cyanide can be inhaled from stomach contents when inspecting viscera. The eyes may also be bright glistening and prominent with dilated pupils. The jaws are firmly closed and there is a froth of the mouth which may be blood stained. Also, it is blood stain in the bronchi. The color of the cheeks and postmortem staining may be cherry red in color. So these are cherry red in color because of oxyhemoglobin. So oxyhemoglobin, since oxygen is not utilized by cells, they get accumulated in the blood itself. So it is present in the oxyhemoglobin is starts accumulating in the blood and imparts the cherry red color to the postmortem staining. The odor of hydrocyanic acid may be noticed on opening the body. The odor of hydrocyanic is typical smell of bitter almond smell is present. So that is typical smell can be detected. In case of suspected cyanide poisoning, the cranial cavity should be first opened, which shows the odor, which is well marked in the brain tissues. There is congestion of viscera and edema of the lungs, mainly because of asphyxia. Serious cavities are ecchymosed. The mucosa of the stomach and intestine is often red or congested. Potassium sodium cyanide produces light corrosion of the mouth. So if the person has consumed cyanide, sodium cyanide, potassium cyanide, it causes corrosive effect in the mouth. Tongue is swollen, grey or blackened or distorted. Spillage into larynx and pressure causes respiratory mucosa damage. Aspiration of liquid or vapor into lungs can cause rapid pulmonary edema and hemorrhage. The mucosa of stomach may be eroded and blackened due to formation of alkaline hematine. Stomach may contain frank or altered blood from the erosions and hemorrhages in the walls. In less severe cases, rugae will be streaked with dark red striae will be present. In case of chronic poisoning occurs produced when the continued inhalation occurs for a long period of time of low concentration of hydrocyanic acid vapors. The symptoms are headache, vertigo, nausea, vomiting, diarrhea, chronic cachexia, mental disturbance, visual defects like scotomata, optic atrophy and psychosis. Coming to viscera preservation in case of death because of hydrogen cyanide, the care should be taken since it is gas as well as it is also poisonous. Hydrogen cyanide is an extremely volatile substance. The blood and viscera should be preserved by adding a alkali and stored in the well stopped bottles in refrigerator for analysis. Specimen of blood should be preserved with fluoride, must be covered with a layer of liquid paraffin to avoid evaporation. About 74% may be lost after some week of storage from reaction with tissue components and conversion to thiocyanate. If death is caused by inhalation of hydrogen cyanide fumes, a lung should also be sent intact in an aluminum bag. Hydrogen cyanide is not produced after death by putrefaction changes. So, mainly if cyanide is present in the blood, they can in long term it can be converted into thiocyanate, so it will not be detected. So, long term storage is not recommended, it has to be analyzed immediately. Hydrogen cyanide is not produced after death, so any hydrogen cyanide detected is because of poisoning. Hydrogen cyanide retards decomposition like carbon monoxide, and to some extent it acts as a preservative because of oxygen binding the affinity they possess. Formaldehyde rapidly destroys cyanide and as such embalming should be avoided before autopsy. There is a specific test to detect if the person has consumed hydrogen cyanide. In this, 5 ml of stomach contains a few crystals of ferrous sulfate is added and 5 drops of 2% sodium hydroxide is added. It is boiled and cooled and added 10 drops of hydrochloric acid. If greenish blue color indicates the cyanide poisoning and purplish color indicates the salicylate poisoning. Coming to circumstance of poisoning, hydrocyanic acid and cyanides are usually used for suicide. It can be concealed in suicide pills in rings or hollow teeth. Commonly, it is used as a suicide pills hidden in the teeth. Occasionally, they can be taken by accident or in fumes of acid by those of working with it. It is rarely used as homicide and as a kettle poison. Kettle poisoning can occur from eating linseed pad due to the natural development of cyanogenetic glycoside. It is also used for judicial hanging. So judicial hanging it is done in certain countries where hydrogen acid gas is used. In this case, the condemned is placed in a chair with perforated seat. A bowl is placed which contains sulfuric acid, and 3 plates of sodium cyanide is placed. The door is sealed, and once the reaction starts, hydrogen cyanic acid is liberated. Which causes through the hole. Unconscious takes place very rapidly, and even though the person may be alive for 10 to 20 minutes. Similar to hydrocyanide, there is one more poison, that is methyl-isocyanate. This is also a poisonous gas. It is fairly stable liquid below 27 degrees, becomes gaseous at 31 degrees centigrade. It is a pungent, sweety smell gas. It is highly volatile and inflammable. Its vapors are denser than air. It reacts vigorously with water, alkaloids, and many solvents. It is used mainly in the manufacture of pesticides, adhesives, and plastics. It is one of the deadliest chemicals and can kill in very small doses when ingested, inhaled, or when absorbed to the skin. So, even a small quantity of methyl isocyanate is very dangerous and can be killed by ingestion or any route. Coming to action, the irritant action of the vapor at biophysical level, it causes irritation effect, causes inflammation, desiccation. It also causes carbonylation action at biochemical level. The vapor causes intense irritation of skin, eyes, and mucous membrane. Symptoms include acute irritation of the eyes, lacrimation, blurring of vision, severe burning in the throat, chest pain, and labored breathing, pulmonary edema which can cause death. About 10% of victims have psychiatric symptoms such as anxiety, depression, sleep disturbances, gas phobia, and feeling of helplessness. The systemic effects are liver damage, kidney damage, methylglobinaemia, and neurological deficits. The isocyanates are potential teratogenic and mutagenic agents. In females, if they get exposed to methylcyanates, can lead to vaginal discharge, anemia, stillbirth, and fetal abnormalities are also seen. Treatment, it is purely symptomatic. Sodium thiosulfate is beneficial and which is helpful to excrete they convert into thiocyanate, and for excretion sodium thiosulfate is useful. Coming to postmortem appearance, there is marked pulmonary edema, increased weight of the lungs to 2 to 3 times of normal, congestion of organs are seen. There is severe irritation of the eyes, nose, and trachea and bronchi, and that occur within 4 days. There may be chances that there may be inflammatory irritation effects may be seen. Victim dies between 2 to 4 days have pink blood, and those who die 5 days after the accident have dark red in color. There is also congestion of organs, toxin necrosis of gastrointestinal mucosa. Later deaths which occurs show pancreatitis, degeneration of brain, heart, lungs, liver, and kidneys. These are my references.